Very warm welcome to all of our attendees this morning, and welcome to the Tuesday morning Toolbox talk. So let's get straight into it this morning on COVID-19. And I'm very sure, speaking to all the plumbers out there, speaking to a lot of people, that you are probably very tired of hearing about COVID-19. In fact, even if you're not a plumber, you're probably also tired of hearing about COVID-19 and the disastrous impact it has already had, not just on our economy, but on many South African lives, in fact, lives throughout the entire world. And the irritation of wearing masks coming up more and more, a lot of people becoming anti-maskers, those videos going viral on YouTube and Facebook, and we've seen them all over. Why is this happening? Well, people are becoming irritated. People don't want to hear about COVID-19 anymore. And I'm sure as plumbers in the industry, it's also having a huge impact on you, whether it be your businesses, your personal lives, or even that of your employees. A lot of companies have had to either close down or perhaps shorten their staff list. And we can really see it has had a major impact. And so when we mention COVID-19, obviously, it's an extremely negative thing, and we appreciate that. We're not going to sit here and say, well, it's here and we've just got to deal with it. We want to understand, what can we do as plumbers out in the industry to continually protect ourselves, because COVID-19 is still a threat. It is a threat to you as plumbers. It's a threat to your families. It's a threat to your business. And we would never want you to let your guard down and be affected by it. So obviously the message today about COVID-19 is not to become complacent. But what can we do not to become negative about COVID-19? Because everything we do around COVID-19 seems to be constantly negative. Well, some tips is not to spend excessive time on all the news around COVID-19, because all the news is going to be negative. And this will cause us to become paranoid and perhaps even anti-COVID to the point that we stop adhering to protocols because we've just had enough of it. And it's because we're hearing so many sad stories. And please don't get us wrong. It's not that we do not feel for these ones. Obviously, we have a lot of empathy for those who are going through such difficult times, those who have lost work, those who have even lost members of their family or friends or employees to this dreaded virus. So how do we then keep a positive outlook during a time that here in April, we've already had a spike early on in this year, and it seems to be going down, but we really don't know. How do we know whether the statistics are actually valid? There's a lot of, how can we say, conspiracy around COVID-19. And so it's very difficult to almost have a positive outlook. And that's because COVID-19 still has the potential to infect us, especially if we are not doing anything to fight it. So again, our message today is don't become complacent on COVID-19. What we want to do is try and keep a somewhat positive outlook toward the situation that we can have an impact on and something that we can control. You see, there's nothing worse than feeling powerless against something. And you would probably agree with this, that when we feel powerless over something, we almost tend to give up to the degree that we do not want to continue on. And many people feel this way. And that's because businesses are closing down, people are losing their lives. And so there's so much negativity around us, especially with COVID, that it's hard to keep a positive outlook. But one thing we do want to say is try not to panic or excessively panic about COVID-19. If you go onto the sacoronavirus.co.za website, there it tells you only 82% of COVID-19 cases are mild. You see patients experience slight fever, fatigue, and cough. It's only 6% of patients that need intensive care. The vast majority of people can stay at home and get better without hospital treatment. Yes, COVID is still very real. It is having a very real impact on our economy as well as the people of South Africa. But we do need to understand that these stats, most COVID cases are mild. So what do we do? What are the actual symptoms? Because we don't want to become complacent to the point that we think, well, if it's mild, we can just continue with our day-to-day life as normal. But we do not want to go to the other extreme where we become so paranoid that when we have a cough, we isolate ourselves completely and go to such an extreme that we do not continue to function. So this is not really what we want to do. What we want to do is look at what are the most common symptoms: coughing, fever, sore throat, shortness of breath. And if you experience any of these, you inform your employer and you take action to prevent spreading this illness. That would mean isolating yourself at home, going for a test. Once you get your test results back, you then do one of two things. If it comes back negative, well, you can return to work once you've got a negative result. If it is a positive result, follow the doctor's requirements. A lot of doctors will say it might be a mild case. You can go home, stay isolated, keep yourself clean, keep yourself hygienic, make sure your house is always COVID-19 free by doing your necessary things to prevent COVID-19 in your home, and you should recover in a short period of time. And so this is very much like another type of illness that we often get, especially during this time of the year, which is the common cold. Now, when you get flu, you have very similar symptoms. You start coughing, you have a fever, you get a sore throat, you have shortness of breath sometimes. And so you start taking medication to help you with those symptoms, but really there's no cure for the flu. And so you have to get bed rest, you've got to take in lots of fluids. But what do you do, generally speaking, leading up to the flu period? So the time of the year that we know generally, this is when we would normally get the flu. Well, speaking to many out in the industry before and asking them this question, they say, well, they have a good routine of a little bit of stretching, walking, running, getting a bit of daily exercise if they can. Many of you said, well, a better healthy eating regime is what you follow. And then a lot of you, in fact, most of you said, working up towards this season, just the few months before getting the flu, you start taking vitamins and minerals, vitamin Bs and vitamin Cs, to constantly boost your immune system, so that should you start experiencing these symptoms, they are a lot milder than if you did or did not take these other meds in order to boost your immune system. So why not do the same thing? COVID-19 attacks our respiratory tract. Obviously, it's going to affect your lungs. There are cases where it starts affecting other parts of our body, other organs. And so what we can do is just keep a healthy body. And a healthy body and a healthy mind, keeping positive and keeping ourselves healthy, is really going to go a long way in helping us to possibly get COVID as not as bad, or potentially not get COVID at all, because we have followed not only the protocols of COVID prevention, but also an immune boosting schedule, keeping ourselves healthy and keeping ourselves safe. So again, we don't want to spend excessive time looking at what's happening in the world, how many deaths there's been, what a large impact it's been having. And it's difficult not to look at this because it's so in our face every day, especially for many of you business owners. It's something that is a day-to-day challenge. And yes, we appreciate that. We know that for many of you, it's affecting your entire life, both business and personal. And so what we want to say is, if it is getting to that point, there are things that we can do to ensure that we continue with our lives, continue with our business. And if that is a possibility for you, and if there's a possibility for you to assist another person who might be going through an even worse time than you are, well, why not try and do that? Helping somebody else, especially in a situation that is critical, always makes you feel good and makes you feel positive. So here's some tips to continually prevent COVID-19. And again, what we want to do is always surround ourselves with these barriers. They are very simple things. It's not going out of your way. Washing your hands regularly is almost something that we did before COVID. Before we eat, we wash our hands. After using the bathroom, we wash our hands. In fact, now it's just become a little bit more regular because we want to ensure that we do not catch COVID-19. So really, what has actually changed when it comes to the protocols? Using hand sanitizer, yes, this is obviously a new one for many, but do you have to use hand sanitizer if you are washing with soap or alcohol, washing with soap and water? No. Notice what it says: wash your hands regularly with soap or an alcohol-based hand sanitizer. Yes, when we enter into shops and other offices, most people are going to request that you sanitize your hand before you go in there. But if you are in your own personal home, or even if you are in your own business premises, there is no need for you to constantly use alcohol-based hand sanitizer. Rather, regularly wash your hands with soap and water. If you do not have access to this, that is when you start using alcohol-based hand sanitizers. What we also would like to include there is, because a lot of people are suffering with eczema on their hands and the alcohol-based hand sanitizer is severely affecting them, there is a cure for this. Just go to your Dis-Chem or Clicks pharmacies, ask them for a good dermatology hand cream, and continually use this. In fact, try and use cream on your hands and your arms. In fact, because that's just very good to moisturize your skin, and you will find that this starts undoing what the alcohol-based hand sanitizer has been doing to our hands. Now, when we obviously do not have washed hands and your hands are now unwashed, before COVID, we would also want to avoid touching our eyes, nose, and mouth. And that is because diseases before COVID also affected us. Many used to get sick even when it wasn't flu season. And that was because we touched our face, especially our eyes, nose, and mouth, with unwashed hands. So again, wash your hands regularly. Avoid touching your eyes, nose, and mouth. Avoid close contact with people who are sick. Again, something we did pre-COVID. If someone was sick, generally you would book them off work, they would take off sick leave, and they would go home. And if they were coughing and blowing their nose in front of us, well, we would keep our distance. Why? Because we didn't want to get the flu. Well, now it's the same with COVID. We just don't want to get COVID. In fact, we don't want to get the flu either, or any other illness. And this again goes back to many years before. It's not like it's a new thing that we started isolating ourselves when we were sick. Again, when it comes to covering up our cough or sneeze, did everyone just cough or sneeze into the air before COVID? Well, no. Etiquette and just general manners as we were brought up, you were always to cover your cough or your sneeze with a flexed elbow or tissue, and then throw the tissue in the bin. In fact, our parents told us, go and wash your hands after you sneezed or coughed. And I remember this as a child. So it was also there before COVID. Clean and disinfect frequently touched objects and surfaces. Another one that we always did before COVID. So we can see that these tips to prevent COVID-19 is something that we were regularly doing. But because it's so in our face now, because it's so pronounced, it may be getting us down. But don't become complacent. Keep positive. Remember, all these tips to prevent COVID actually are preventing other illnesses and diseases from affecting us and our family. So, as a reminder, wash your hands regularly, avoid touching your eyes, nose, and mouth, avoid close contact with sick people. And if you are sick, please ensure you follow the protocols of isolating yourself and getting tested if needed. Cover your cough or sneeze, and then clean and disinfect all frequently touched objects and surfaces. Now, we've gone out of our way at IOPSA to try and look and find the best cleaning and disinfecting products for you, ones that do not overly damage the tools and equipment that we use, or your hands, or even the surfaces in your home, as well as ones that are effective against COVID-19. And we've got a list of these products for you. It's just a suggestion. We've obviously done our research, and we are doing this at our head offices out in Edenvale, ensuring that we constantly sanitize for the protection of our staff, as well as for any members from the IOPSA members coming to visit us at our offices, or any visitors that actually pop in there, to ensure that they are safe. And if you'd like this information, we're not going to post it on here. You can just get in touch with us, and we'll be sure to assist you with that info. But now there's further things that our IOPSA has done in order to ensure your business can continue to run, and that you have the resources available, especially when it comes to COVID management for your company. And so our IOPSA is providing you with the following. And please remember, all of these are also in Word document, specifically your COVID-19 management plan. We've designed one for our IOPSA, we've put it in Word document, and you have this available for your company. It is a template, so we do request that you make the necessary changes to make it specific to your company, or perhaps you are working at a client and your client is requesting this to be site specific as well. So please do the little bit of research and ensure that that plan is obviously specific to your company or specific to the site we are working. Then the awareness training we've done, as well as the compliance officer training. These are 2 free training courses to all IOPSA members. If you haven't done so already, reach out to us on one of the email addresses below. We were having issues with the compliance officer training. The awareness training went very well, and we thank all 1,400 of you already that has taken that awareness training course. But the compliance officer training, we just saw that there were so many people actually using or going onto this training that there was a few glitches in the system. The IT guys are working on it. In fact, I believe they have already sorted it out. So those of you who are busy with the compliance officer training, I know some were on part 1 and some were on part 3, and they were having issues with getting the second section. That was just because of the overwhelming amount of people that actually logged in to take this course. And so we apologize for that inconvenience, but it is being sorted out. And I'm sure that in the next day or 2, you will probably be getting the link to complete that training. Remember, both of these courses, specifically your compliance officer training, is accredited through SIOSH. So it is a SAQA accredited course. It does come with CPD points. It also comes with CPD points from PIRB. So the requirement in order to do your compliance officer course is for you to first do the awareness training. So if you have not done the awareness training, you have to do that first, as it is part 1 of session 1 for the compliance officer training. And then once you have done that, you can then request the link for the compliance officer training. Again, it's free of charge to you. It takes a little bit of time, a few megabytes to watch the videos and answer the questions. And within 2 weeks, you will receive a certificate stating that you've gone through this training or that you are competent as a compliance officer. There are also posters that we've given out that you can post obviously on the walls and in your bathrooms and offices to constantly bring that awareness to your staff as well as your visitors to your company. And then the appointment of a COVID-19 compliance officer. Again, it's all in Word document. Your risk assessment's the same. And then all government documentation that we have found necessary, either to notify the Department of Labor of a COVID case or to get in touch with the NICD, or even to use the online portal on notifying them of a positive case in your company. All of this information is there. It's in a whole COVID pack. In fact, we've got an entire occupational health and safety file pack that can be used, from health and safety plans, policies, procedures, toolbox talks, registers, and checklists. Again, all in template format. It's not site specific. It's not company specific. We've put as much information in there as we can possibly give you. So if you are a safety professional out there, and maybe some of your contractors do not have safety files, you can make use of this as well. Reach out to us. We will give it to you free of charge. It's not something that we are only giving out to certain people. The reason for that is, as IOPSA, we really want to make a huge impact on OHS within the community. And so if you need anything, please reach out to us so we can see if we have this available. And we would love to provide more information and more resources to keep you guys positive in the industry and doing your best to ensure your company runs and your staff are safe. So as a final note, how do you stay positive about the future? Although we don't know what the future holds, we can still keep a positive outlook. How do we do this? Well, ensure you adhere to the protocols of COVID-19. We also want to ensure that we constantly have a good outlook on the prevention of COVID-19. So do your part, keep yourselves, your families, and your staff and your clients safe with any interaction that you have with them by just following those simple rules. Things, again, that we did even before COVID-19. So can you stay positive? Well, we hope you can. We know that it will still have an impact. We do appreciate that. We are realistic about what is currently happening, but that doesn't mean that we cannot control ourselves as well as our companies, our families, our employees, by ensuring protocols are strictly adhered to and that we have an impact on ourselves and not constantly stressed or negative about what is happening. So we thank you very much, and we look forward to speaking to you again next week.